term lumbar laminectomy sounds complicated, but it is a simple procedure that dates back to 1901. With only one incision, the surgeon removes the diseased bone and replaces it with a metal cage known as a laminectomy. Then there's what you might actually see, an X-ray or MRI showing the metal cage of screws on your spine. The results are immediate and uncomplicated, hopefully. That aside, unfortunately, chronic low back pain can be difficult to treat because many patients must undergo multiple surgeries in order to achieve any results at all. Fortunately, physical therapy can help reduce some of that discomfort and return you to daily life faster than waiting for surgery. If you have some back injuries, you like our videos and want more videos to improve your health, don't forget to smash the subscribe button. Can physical therapy help my back pain? Even though lumbar laminectomy is a relatively simple surgery, patients suffer severe chronic low back pain after the procedure. Many of these patients must undergo multiple surgeries in order to receive relief from their pain. This can be frustrating for both doctors and their patients. Studies show that up to 88% of patients are left with some sort of chronic back pain after a lumbar laminectomy. That's where physical therapy comes in. If you have undergone a lumbar laminectomy, physical therapy can help you recover from your surgery faster than you would by simply resting at home. Benefits of physical therapy for back pain. Physical therapists can help you recover from back pain following a lumbar laminectomy by providing specialized care tailored to your individual needs. One study examined whether physical therapy would reduce pain, disability, and improve patients' functional ability following a lumbar laminectomy. The results showed that after only 8 weeks of physical therapy, patients experienced greater improvements in function compared to those who did not undergo any physical therapy treatments at all. The benefits of physical therapy were so great that those who underwent physical therapy required less medication to control their pain, explains Dr. Stanley. This means your physician may be less likely to order pain medications for you following a lumbar laminectomy because you will already be feeling significantly better. The results of the study were published in the Journal of Bone and Joint Surgery by Dr. Stanley and colleagues at Harvard Medical School. Risks of physical therapy after a lumbar laminectomy. Some patients are concerned that physical therapy after a lumbar laminectomy might cause more damage than the surgery itself, but this is actually quite rare. You can rest assured that physical therapy will not harm your recovery or prevent your surgeon from performing a new procedure to help you recover faster from your surgery. Lumbar laminectomy and physical therapy. Studies have shown that physical therapy can help you recover after a lumbar laminectomy. That's why you should always see your doctor immediately to discuss your options following a lumbar laminectomy. Then, make sure you undergo physical therapy sessions to reduce your pain and improve your recovery time. Visiting the hospital regularly will also help prevent any other complications during recovery. Back pain and physical therapy. In addition to alleviating pain, physical therapy can improve your quality of life following a lumbar laminectomy. After an operation on your back, you may find it difficult to work and perform normal daily tasks. Physical therapy can help build muscle strength in the affected area, so you can return to your life again sooner than you would have without it. Will physical therapy help? It's really important that patients understand how physical therapy aids in recovery from surgery. By understanding the benefits and risks of physical therapy for a lumbar laminectomy, patients can have confidence in the doctor's recommendation for their treatment plan. As a complete and total nerd, I've been looking into the statistics of lumbar surgeries over the past 25 years. My favorite so far was a study done in 1990 looking at how many lumbar surgeries are done per year, by who, and whether or not they resulted in superior back function. As you can see, nearly 600,000 hip and spine surgeries were done in 1990. Of this number, more than half were spinal surgeries, around 500,000, and the other half were hip replacements, more than 300,000. While the statistics might not be surprising to some people, what was shocking about this study is that it doesn't even account for all back surgeries. It's my understanding that over 90% of all back surgeries aren't performed on people with a herniated disc or a bulging disc. These numbers alone would skew the numbers quite significantly. I'll save your brain from doing the math on that one. Other ways to reduce your back pain. In terms of nutrition, I often recommend my no-fuss, no-muss dietary plan. It's a simple way to eliminate refined sugars, gluten, and alcohol from your diet for several weeks. The goal is to simply give your body a rest from its normal inflammatory diet by removing processed food and certain types of ingredients that cause inflammation in the long term. Your diet is so important. Make sure you're eating a diet that includes healthy proteins, healthy fats, low sugar, and very little to no gluten. Paleo diets are a great option, and other types of high-protein diet plans can also help. You should avoid processed foods as they tend to increase inflammation in the body. If you suffer from back pain, you can find more details on natural remedies for your health here. Lastly, when it comes to sleep, you can also help your back by sleeping with a pillow that helps your cervical spine stay neutral instead of forward. This is what my pillow does. Sleep positions that cause more pressure on the neck and lower back. Anterior positions, inclined positions where the top of your head is up against a wall. Sleeping on your side should be avoided as well. Side sleeping with pillows between the legs can also cause pressure on the lower back, while sleeping on one's stomach or back can be problematic as well. Sleeping with a pillow between the legs usually does not cause any problems, but sleeping with an extra pillow under your knees might be a problem for some people. Neutral sleeping position. Sleep with your head in a neutral position on a thin pillow, looking slightly upwards, and try to avoid elevating your head at the neck by placing a couple of pillows under your knees. A pillow under the lower legs is probably fine for most people and might actually help you sleep better. Many people have problems with their neck or back pain due to sleeping with their head slightly elevated, and this can cause problems if you were accustomed to sleeping like that for many years. If changing your sleeping position helps you feel better and lessens or eliminates your back pain, it was probably the right decision. Lumbar pain is something that is unfortunately very common among everyone. It can be caused by a herniated disc or bulging disc, but in many cases, it can also be caused by other reasons. And of course, always remember to listen to your body and see a professional if your pain is too important. I hope you enjoyed this video. You're going to heal your back and you learned something about the benefits of physical therapy. If you have any questions, feel free to leave a comment below. Thanks for watching this video, and if you want more videos on how to boost your metabolism and lose more weight, make sure you subscribe so you don't miss out on future videos.